I don't know if you're aware of this or not, but the person that is using your patient portal probably isn't your patient. When my husband was diagnosed with multiple comorbidities, I became the one that was managing 10 different doctors, 9 specialists, and more health tech tools that I could count. Resetting passwords, re-entering the same information over and over again, and then calling to fix portal errors. I spent almost as much time fighting with the patient portals as I did doing the actual caregiving. Every hour I spent on hold, that's unpaid labor that your platform externalizes onto families. If you're building patient engagement tools and wondering why adoption stays below 30%, this is why. I'm going to share some very personal things in this video today about my experience as a family caregiver for my husband, managing his complex chronic conditions and the blind spots that health tech companies keep missing. I'm going to show you the 4 big gaps between what companies build and what caregivers actually need, why ignoring caregivers is hurting your retention metrics and your customers' clinical outcomes, and the perspective shifts that could transform your product roadmap forever. Let's go. When you design your SaaS platform for the patient, that's good, but you also need to keep in mind the people that will be caring for the patient. In my particular case, my husband wasn't using those platforms day to day. I was the one logging into portals, scheduling appointments, managing medication lists, and communicating with providers. Not my husband. But every single platform treated me like an afterthought. I'd have to use my family member's credentials, act on his behalf in messages, and navigate interfaces that were designed for someone managing their own care, not coordinating care for someone else. And this led to a lot of frustration and workarounds, and eventually probably leaving features behind that really could have helped us. According to the AARP, family caregivers provide 37 billion hours, that's billion with a B, 37 billion hours of unpaid care every year. When you ignore the caregiver as a user persona, you're not just creating a poor user experience, you're also sabotaging your own metrics for adoption. Family members and caregivers are often the ones who will drive engagement, coordinate provider communication, and champion your platform to the care team. But if your product doesn't acknowledge our existence or support our workflow, we'll stop logging in. And when the caregiver and the patient both stop using your platform, the patient never starts. During the most intense period, I was managing relationships with a primary care doctor, a cardiologist, a nephrologist, an endocrinologist, a gastroenterologist. Oh my gosh, and there's even more. There were a total of 9 specialists and a primary care doctor. That's 10 doctors. 10. And here's the kicker. Every single one of those doctors had their own patient portal. So that's 10 different logins, 10 different interfaces, and 10 different ways of displaying the same information. Of course, there was no care coordination, so those doctors and those platforms didn't talk to each other. When the cardiologist needed to know what the endocrinologist prescribed, I became the integration layer. I was literally copying and pasting information between portals and maintaining my own spreadsheet of medications because none of the platforms agreed on formatting. And I was playing telephone between systems that should have been connected. This is a common problem, and it's not simply an interoperability problem. Your customers, the hospitals and health systems, they're losing money because of fragmentation in this situation. When I finally gave up on using the official portals and created my own system using spreadsheets and Notion, your engagement metrics went down. When my husband ended up in the ER because of a medication interaction that none of the disconnected systems caught, that's a hospital readmission that hurt your customers' bottom line. I work in tech, so I understand you've got all kinds of different technologies at play, like API integrations, data import tools, and interfaces designed for people that are managing complex multi-provider care, like me. But you have to understand that when you're designing these SaaS platforms and apps, healthcare is always happening across multiple systems. So you have to design for that and take that into consideration for your user experience if you want to be successful with patient engagement. Healthtech SaaS platforms tend to assume a one-to-one patient relationship. One login, one user, and one person managing their own care. But that's not how caregiving works. I needed access to my husband's medical records, test results, appointment schedules, and care team messages every day. And you know what every single platform made me do? Share their password, use their login credentials, and pretend to be them when I'm sending secure messages to doctors. Your security model, the one that's supposed to protect patient privacy, actually forced me into the exact behavior that your platforms are trying to prevent. And my situation is not an edge case. The AARP estimates that 53 million Americans are unpaid family caregivers right now. That's 53 million people that need legitimate access to someone else's health information, not for nefarious reasons. But your platforms are making us break all of the terms of service just to provide basic care. Now, I know some platforms have started adding caregiver portals or proxy access, but let's be honest. The patient is the person that has to initiate the request, first of all. And then there's paperwork that someone has to fax or mail in, even though we're in the 2020s. Then someone at the health system has to manually process it and approve it. The whole thing takes weeks, and it requires the patient to be cognitively capable of navigating this bureaucracy. And it assumes that the caregiver relationship is formalized enough for legal documentation. Meanwhile, families need access now, when someone's in the hospital, when there's a new diagnosis, when decisions need to be made quickly. So they share passwords, they screenshot sensitive information and text it to each other, and they create security risks that would make your compliance team break out in hives. This is a product design problem. You've created security theater that actually reduces safety while destroying the user experience for the people who use your platform the most. We need for you to make the appropriate caregiver and family member access easier, faster, and more secure, with permissions that will respect the patient autonomy and the reality that the caregiver is making those decisions. Let me tell you about one of the loneliest moments in caregiving. It's 11 p.m. and I'm staring at a patient portal message from a specialist asking me to review treatment options and indicate your preference by tomorrow morning. I'm looking at medical terminology I barely understand, treatment protocols with different risk profiles, and a drop-down menu that says select option A, B, or C. So not only am I sitting up trying to understand what they're talking about, I'm making this decision for someone else. Someone that I love, someone who's trusting me to get this right. And I'm thinking, do I have enough information? What would they want me to do? Am I choosing what's actually best for them or what's easier for me to manage? Every time I had to click I consent or I acknowledge on behalf of my husband, I felt that weight. But your platforms treated these moments like simple checkboxes. No decision support, no context for proxy decision makers, and no acknowledgement that caregivers are in a fundamentally different relationship to these choices than the patients that are making the decisions for themselves. Then, when I didn't feel confident about my decision, I'd spend hours, unpaid hours of course, researching on my own, leaving messages for nurses with questions, trying to track down someone who could give me context for your platform that should have been provided in the first place. And that was time away from my job, time away from my own health, my kids, and caring for my husband and our children. If you multiply that experience across millions of caregivers, you're looking at billions of dollars in costs that will never show up in your operational metrics, but they absolutely show up in your engagement numbers and your customer satisfaction scores. Patient engagement platforms must recognize that caregivers aren't just patients with extra access. We are proxy decision makers who need decision aids specifically designed for our unique burden. Things like, here's what we discuss with the patient about their preferences. Share decision-making tools that acknowledge the care team. Context about what questions to ask before making this choice. Plain language explanations alongside the clinical details. This is better engagement, better UX, and a better customer experience because it acknowledges the emotional and cognitive weight of making healthcare decisions for someone you love and building the tools that will actually support that reality instead of ignoring it. Maybe there's something I've said in the last 6, 7, 8 minutes that's challenged some assumptions about your product roadmap. Here's what we can do about it. It's called The 5 Biggest Patient Education Mistakes and How to Fix Them This Quarter. And it's a free 5-day crash course specifically for health tech executives whose products serve patients or caregivers. My promise is that by day 5, you'll know exactly how to fix your patient-facing content and get better adoption. The link is in the description. I did a deep dive on why patient portals fail after the first login in this video right here. Check it out.